Maintaining the number of medical professionals, especially physicians, has been a tough task for communities across the region for many years. As a result of the global pandemic, resources have been strained even further, with some medical facilities experiencing burnout of physicians. To address that, recruiters at the Geraldton District Hospital in Greenstone have shifted and expanded their efforts, which has so far paid off. Adam Riley has the details.
Greenstone has a lot going for it right now as the result of the construction of the new Greenstone mine, which continues to bring workers and new residents to the municipality. With an increased population comes the increased demand on the healthcare system. And while Geraldton's new $21 million expanded emergency department, which opened last year, has been beneficial from a staffing perspective, doctors were running on fumes, which on more than one occasion reached a critical point.
We were faced with a possible closure with our emergency department in July 2021 and December 21.
Greenstone Deputy Mayor Jamie McPherson says normally locums from other areas of the province would come in and relieve pressure, allowing full-time physicians some time off. But COVID-19 has changed the game through new health and safety and isolation protocols.
Well, some of them cannot come up because of the protocols. The amount of time they'd have to isolate, the 14 days before and after. And so that meant the load fell on the existing physicians.
To counter that and prevent burnout, Geraldton District Hospital's physician recruitment team shifted their focus to bring in a nurse practitioner, which, unlike regular registered nurses, can diagnose, order tests, and prescribe treatments. Rochelow says immediately a positive effect was felt in the emergency department, with 93% of patients being taken care of by the nurse practitioner. The success of that introduction was noticed by others and allowed GDH to have an impact beyond the Greenstone area.
Atikokan was actually struggling with the exact same thing we were struggling last summer. They were looking at potentially closing the emergency department. They reached out to us and we actually sent our NP down to Atikokan, and she was able to work in the emergency department, which kept them open.
Currently, GDH is looking to add a second nurse practitioner to their ranks while continuing to entice physicians to move to Greenstone. Rochelow says plans are in the works to create an urgent care clinic in the emergency department to further reduce strain on the system. Adam Riley, TBT News.